Lots of diseases showing up outside of the carnival and after the carnival, and in some cases they were around since before the carnival. This morning, we're chatting with the Secretary of Health, Wellness and Social Protection from Tobago House of Assembly, Dr. Faith Brebnor. Good morning to you, Doctor.
Good morning, and thanks for having me this morning.
Not a problem at all. All right, so there were a couple of things that I've been hearing about. Some children have been, well, at least I can say safely that schools have closed a couple of times with hand, foot, and mouth disease. Tell me, first of all, what exactly is hand, foot, and mouth disease so that everybody's on the same page?
Certainly. So, hand, foot, and mouth disease. So, there are actually two types of diseases that are going around right now in schools. Let me start by saying, though, that this is a common thing. This is a cyclical thing. So, like you see every now and again, you have a flu season and a cold season and so
Yeah.
forth. We also have a hand, foot, and mouth season and an impetigo season. It's just that I think people are now finally aware of it, or probably because of social media, people are more conscious of it. So, what
Mm-hmm.
is happening? So hand, foot, and mouth disease really is a viral infection. It's a contagious thing, so it passes relatively quickly. Um, as you rightly said, the children are the ones having it. So the cases we are seeing are primarily of children younger than 5 or so.
Mm-hmm.
And it really includes having sores around the mouth, and having a rash on the hands and the feet, hence the name hand, foot, and mouth disease. Um, Let me also throw in though, because we are seeing them at the same time this year. Impetigo, on the other hand, is a bacterial infection, and it includes basically having sores around the same hand, foot, and mouth. So again, both are cyclical, both are common, both are things that we are seeing. So this is not a new thing that is just coming out of anywhere. But we really, really wanted to let parents and teachers know that if you see this happening, we kind of need you to keep the children home.
Now,
That is the key takeaway point.
how do we tell the difference between impetigo and hand, foot, and mouth disease, or is there a difference at all?
So the biggest difference is that for hand, foot, and mouth disease, you would actually see a rash along the hands and the feet. While for impetigo, you don't see the rash; it's just the sores. So if you just pull up on social media, pull up on Google, you would actually see pictures that looks like a reddish, blotched sore around the mouth. While for hand, foot, and mouth disease, you will see a rash on the hands and on the feet. So that is the biggest difference in how they actually look, how they actually present themselves.
All right, so in terms of prevention, is there a way to prevent the children from getting hand, foot, and mouth disease or impetigo?
Yeah, so it is the same things that we've been telling you about, all of the hygiene things. Um, yeah, you smile. So keep surfaces clean, keep your
Mm-hmm.
hands clean, because remember, it's about one is spread through a bacteria, the other is spread through a virus. So basically, it is what you need to do to keep the place clean so that we don't have bacteria running around and we don't have a virus running around. So wash your hands, wash surfaces. If your child has it, then keep the area clean, because what happens after a while is you may see a little bit of a pus forming, and you may see a little bit of the ooze happening. And it is really out of that ooze that, if that ooze touches another person, or touches another surface, then that is how it's spread, basically. So
Yeah.
keep the areas clean. And if, for example, you have a child that has it, of course, you have to wash the items that they have been in contact with. So wash the sheet, wash the towel, wash the clothes, ensure that the surfaces are actually clean because they've been in contact with those surfaces.
Now, you mentioned that, well, we accepted that children are the ones presenting with it mostly, but is it that adults can't get this, or is it that the symptoms present differently, or how does it work?
So yes, adults can get it, and the symptoms are basically the same. But for some reason, children are more susceptible, probably
Mm-hmm.
because of the way children interact with each other. In school, children running up and down, playing with each other. Um, my mother, who is a preschool teacher, always speaks about the fact that children are always dirty. Children always have a runny nose, that kind of stuff. So because of how children tend to interact with each
Mm-hmm.
other, they are more likely to get infected if there is something happening. So yes, adults can get it, but for some reason, children are the ones that we are seeing the higher rates at this point.
So let's talk treatment. You mentioned just keeping the place clean, which is the preventative measures, and of course washing
Yeah.
all the utensils that the children would be using or anything that the children use while they have the disease. But is there a specific treatment to make it go away faster? Do you just let it run its course, or how do we deal with it?
Right. So because the impetigo is a bacterial infection, if you can have an antibacterial cream, that helps it. Unfortunately, for hand, foot, and mouth disease, there really isn't anything that we can give per se to treat it. So that is why it's important to see a doctor, a health professional, so that they can identify which one it is. If you can't, so that, if it is the impetigo, we can give you a little bit of that bacterial cream, a simple bacterial cream, antibacterial cream, and that would help a little bit. But, we kind of just have to let it run its course. And that's why we've been saying it usually goes away within a couple of days. Let it run its course, keep the children home, because once you send them into the schools, it means that they are going to then infect other children in the school, and then you have an entire school that has to shut down. So once you see it happening, keep the children home for the couple of days until it runs its course, and we should be fine.
All right. Just so that everybody's clear on it, in terms of the side effects of carrying, I mean, besides, of course, infecting other children in the school, right? Tell me, I know the symptoms you mentioned, the rash you mentioned, but are there any like actual feelings of being unwell or things that would make it painful for the person going through the process or the child going through the process?
So, because the child is infected, the normal bodily response to an infection is usually a fever.
Right.
Yeah. So they will get a fever because the body now has come in contact with this virus or this bacteria. So yes, the fever is common for both. You would get, swollen lymph nodes because, again, that's your body responding to an infection. For the impetigo, you do get the sores and blisters that, because it's an open wound, it's a sore, it's a blister, it is going to pain a little bit. For hand, foot, and mouth disease, you may also get a sore throat. Again, your body is going through the process of trying to fight this infection that is happening. So those are the main symptoms that you will see. Of course, again, your body trying to fight off, you kind of feel irritable, you feel unwell. Again, your
Mm.
body's trying to fight this thing that has now come inside of it.
All right. Well, I mean, I thank you very much for all this information. This is a lot of process to make sure that we keep the children safe and, of course, ourselves safe as much as possible. And it boils back down to cleanliness and making sure that you keep your environment clean, which is the start of preventing either of these. So we have impetigo, we have hand, foot, and mouth disease that both spreading, and they're both more susceptible to children, you mentioned, right?
Yes, certainly. And the critical point, yes, cleanliness, the hygiene things that we've been talking about. If you see your child, the sores, the rash, or anything like that, please, please, please keep them home so that we don't have to shut down the whole school. Please.
Well, I thank you very much for joining us this morning, Dr. Brebnor, and do enjoy the rest of your day.
Thank you for having me.
Not a problem. Ladies and gentlemen, that is Dr. Faith Brebnor. She is the Secretary for Health, Wellness and Social Protection in the Tobago House of Assembly, sharing with us some information about hand, foot and mouth disease as well as impetigo. One is a bacterial infection and one is a virus. So we learned this morning.
Look at you.
Paying attention.
Yes, you are. But as we know, children's hands are always dirty. And it's interesting because we will tend to, as adults, a little fever, right? The fever breaks, we send you to school. But in this case, you definitely want to stay away from school.
Well, yeah, it's not just about the fever, the rash, the sores, to make sure that all of that passes. And of course, go see a doctor because that'll be the best option in terms of making sure that you're treating the right thing. You know what I mean? So the hygiene, keep your skin clean, keep your rooms clean, keep your surfaces clean. I mean, this is the same things we talk about during COVID, and it's so interesting.
Really easy to go back to be honest, for me at least. But I say that as a childless person, so good luck to the parents. I know it's not easy, especially if they are not feeling well, so they're going to be a little bit more miserable than usual. They want to do things. It's going to be tough. But I'm glad that we have the information to make the distinction, and we know that it's something that is manageable. We let it run its course, but we do want to get medicated and sanitized as much as possible. So that course should be shorter rather than an epidemic or pandemic all over
and the thing is that you don't want it to infect the whole school, because I mean, as a parent, we've had a situation where the school had to shut down for a day to be able to sanitize and clean out the school, because a couple of children came to school and they were concerned that it would spread with too much children. So they're like, wait, hold on, let's go back home. Everybody go home. Let me clean out the school and keep them home. Send back the rest. And so far, so good.
So far, so good.
But I know that it wasn't only one school affected by it. And like Dr. Brebnor said, they're going to have that happen cyclically. So almost every year, every so often, we would see this show up in schools. And it's just for us as parents to be diligent about it, to be responsible about it. And I know sometimes it's hard to say, well, I'm keeping the child home because you still have to go to work and all that stuff. But it's for the greater good. So find a way to make the sacrifice, yeah? All right, let's take a quick break and we come back with more on the Now Morning Show. Stay tuned.